Welcome to the Run Radio podcast. My name's Trina Wilcox, and my guest today is Abigail Emery, Dr. Abigail Emery of Bloomwell Family Wellness. Welcome.
Yes, thank you so much for having me. I'm excited.
Yes, I'm glad to talk with you. I've been wanting to focus a lot of the podcast more on what people go through with their chronic conditions and how people like you can help them. So you hear a lot about functional medicine. Can you kind of explain what that is?
Yeah, absolutely. So, functional medicine is a healthcare field that takes a patient-centered approach to not only reducing your symptoms, but also helping you live a healthy lifestyle and achieving overall wellness. Really, functional medicine asks two questions: what's not right, and why is this not right? So, it can look like going to a provider for lab testing. It could determine if there are any environmental toxins that could be affecting the person and their health. It could also look like going to a chiropractor and having a thorough functional evaluation and then having adjustments or exercises.
Okay, so why did you choose functional medicine?
Well, I've always had a passion for serving others. I really believe in the body's ability to heal itself, and I've witnessed this on a personal level. I want to be able to help people live active lives, and that's why I became a chiropractor. And functional medicine really allows me to help people in another way. And I know that some people have lost hope in the medical field and they're looking for other answers. And so I'm excited to provide them with other answers too.
All right. So when it comes to chronic conditions, which ones do patients come to you for and what do you treat specifically?
So I do offer a holistic perspective and I treat the whole person, not just a symptom, but really the most common conditions that I treat are arthritis, headaches, and migraines, and chronic pain, such as fibromyalgia or degenerative conditions like arthritis. And oftentimes there's a musculoskeletal component with these. You think of a bone that is restricted or not moving well, or a muscle that's just too tight and inflamed. But with each of these, there's also a nutrition component and an environmental component there. So it's important to address all of those other factors like your diet, your exercise, stress, and even emotional health.
How do you know which chronic conditions are going to respond to what treatments? Is it kind of trial and error, or do you usually have a pretty good idea of what the patient's going to need?
Yeah, I typically have a really good idea just after that first initial assessment that I do with them. Um, Number one, I got a world-class education at Logan University College of Chiropractic, and with that, I know that every doctor uses that education in order to evaluate a person, but any doctor will tell you that they also use their intuition. And so I just want to tell a quick story if I can.
Sure, please.
I had a young mother who was coming in to see me for low back pain. And so I was adjusting her. And one day she came in and she said that her left leg was really swollen and it didn't feel right. And so, I did some testing there, but I didn't adjust her that day. I actually referred her to urgent care, and it turned out that she had a blood clot in her leg. So if you can imagine, if I had gone ahead and done an adjustment or even pulled on her leg like I would for a hip adjustment, that could have done more harm than good. So number one, you need to make sure that your treatment is safe. But number two, you need to make sure that you're doing the right thing for these people who are coming to see you. So I think that's why it's so important to really do a thorough exam and understand where that person's been, what they've experienced, and determine why and what's going on.
What are some of the complaints that you get most?
Most common complaints, I would say chronic pain is number one, but also digestive disturbances. I see this a lot in children, constipation, um, different things that could be related to diet or too much stress, like hormone imbalance and trouble sleeping. So everything is full circle and more of a holistic approach, just trying to address all of those things.
What are some of the things that we as patients can do better ourselves to kind of manage pain on a regular basis?
Yeah, I mean, people have a lot of options. You can buy a tool like a massage gun. You can try homeopathic supplements like Arnica montana is a really good one. You can even try other anti-inflammatory supplements as an alternative to some of the over-the-counter medications that people can take. So turmeric is a good one that I like to prescribe as an alternative for, over-the-counter medications. But you could also just work on mobility. So you could go to a yoga class, go to an exercise class, walk outside, that way you're reducing stress, but you're also getting your body moving, and that'll not only keep you healthy, it'll also provide, stress management and just get those endorphins going so you feel better.
Cool. Very good. You
Yeah.
said a lot of people have kind of lost faith and given up on the medical community, but a lot of times it could come down to just recognizing that you need to change healthcare providers. What
Mhm.
are some of those signs that we need to be paying attention to so we know, hey, it's time to
Yeah,
change?
right. I think number one is you need to make sure that you're being heard. If you're only spending a few minutes with your doctor and all of a sudden you've got a script or you've got a procedure set up, you know, it may not be the best thing for you. I think it's important to make sure that you're being listened to and your doctor is taking the time to really evaluate what's going on. I had a good friend who went in to a doctor for knee pain, and he could tell that the doctor wasn't really listening to him. And before he knew it, he had a shot in his knee, and he didn't know what was going on.
Oh,
um, it was shocking, really. And the next appointment with that doctor, he said, "Hey, look, you need to listen to me. You're lucky that shot worked and helped my pain."
yeah.
um,
Yeah.
so that can happen. I had a patient one time who had been seeing chiropractors for years, and she even had an MRI of her lumbar spine, and none of her chiropractors had looked at her MRI, and her medical doctor told her that the MRI was normal. Okay, so I took a look, and it turned out that she actually had cysts in her lumbar spine in between her L5 disc and her sacrum. And so if you can imagine, cysts are not meant to be there, and they're actually pinching on a nerve. Um, and so it's very unfortunate that she had been treated for so many years for this condition, but she wasn't treated correctly. And so I actually referred her to a neurosurgeon in Springfield who was able to help her.
So that kind of brings me to patient advocacy, which is very important. And I don't know that often enough patients are prepared to advocate for themselves. What kind of advice do you give your patients when it comes to advocating for their health?
Right. Yeah, it can be very intimidating. Not only does it raise blood pressure whenever you walk into a doctor's office, you can feel like you're not able to express exactly what you're feeling, or you may not have the time to tell your doctor what's going on. So just remember that your doctor works for you. You're hiring them to do a service for you. And so I often give people educational resources like websites or blogs, other books where they can read more about their condition. And I think that education is important. But just remember that you're also in charge of your lifestyle and how that can affect your health too.
Yes, very much so. What is a good plan for a person with a chronic condition when it comes to managing their symptoms?
Really just learn as much as you can about your condition, and you know, it may take seeing multiple doctors or multiple providers who are skilled in that condition so that you can really get the answers that you need and also stay strong. Um, it can be a journey for a lot of people. It can be pretty intimidating to go down that road, but I want people to know that they have hope, and there are answers out there.
Can you talk a little bit about the differences of acupuncture and then chiropractic care and even other functional treatments?
Yeah, absolutely. So chiropractors like me are licensed healthcare providers, and we typically evaluate the spine and we perform chiropractic adjustments with our hands. And so that promotes healing just by reducing nerve interference to the nervous system. And the nervous system controls everything in the body. So when it's not functioning optimally, There are things that can go wrong in any aspect of your body. Acupuncture is a little bit different. So that is an ancient Chinese treatment that was developed in China thousands of years ago. And so it has stood the test of time in that regard. But it's a complementary medicine where the skin is actually pricked with acupuncture needles to alleviate pain, reduce stress, or any kind of physical, mental, or even emotional conditions. Functional medicine, what I typically think of with that is doing lab testing or taking supplements, evaluating a person's diet, and then just making specific recommendations or suggestions to alleviate any kind of toxic stress, toxic burden. And so that allows the body to heal faster.
Okay. So the CDC states that there are 6 in 10 adults in the US with a chronic disease, and 4 in 10 have 2 or more chronic conditions. How can we prepare ourselves for the possibility of acquiring a chronic disease? And how do we live a full life after a diagnosis?
Right. Yeah. Really, it's important to consider a person's goals here. So, a lot of my patients want to be able to provide for their family. And one thing that people need to think about is what would happen to your income if you developed a condition where you couldn't work. So, supplemental insurance is really important there, possibly a accident or disability policy that can cover your income should anything happen. Also provide social support through counseling or even classes where you're meeting with people who are also struggling with the same things. That can be really helpful. And that can help you kind of navigate that disease and the hardships that go along with it. I always suggest that people, take a yoga class or talk with a personal trainer about their options there. Tai Chi is also a great way to exercise, and that way you're building the community, but you're also moving your body in a great way.
Those are great tips. Thank you very much. Anything else that you want to share that I haven't thought to ask?
Oh gosh, I just want people to have hope and to know that they can get better.
Very good. Where can people reach out and stay connected with you?
Yeah, the best way is to email me if you want to subscribe to my email list and my blog. That is Dr. Emery at bloomwellchiro.com, or you can follow me on Instagram or Facebook at Bloomwell Family Wellness.
Sounds great. Thank you so much for sharing. I appreciate your time.
Thank you.